just like to say thank you for coming here today. And today is a day that is very important here in St. Lucie County because you are an advocate for our citizens here in this county to make certain that they get good information. So we thank you for coming and making certain that that does happen. Okay. Today you will have Kim Kostler, and Kim Kostler is an epidemiologist here in St. Lucie County for the health department. You have Clint Sperber, who is our county health officer, and you also have Janelle Yost, who is the superintendent for St. Lucie County Public Schools. So, with that, we will have you begin. Clint will start, and from there, if you have any other questions, but how we will do this, they each will talk, and then we'll come with the Q&A.
Thank you. Thank you again, everyone, for attending. My name is Clint Sperber. I'm the County Health Officer for Florida Department of Health in St. Lucie County. So yesterday, late afternoon, we were alerted from the state of Florida that we had a confirmed case of measles in an unvaccinated child. So upon learning this event, what we do, just as we would do with any other investigation, is we work with our partners. So learning that it was a child, I immediately got in touch with Superintendent Yost, and we started our initial investigation. So we will get a little bit more into it with Kim Kostler as far as what that does consist of. But I do want to stress this is the initial part of our investigation. So I'm quite sure a few of the questions that will come, I just need everyone to know that we are in the early stages. But what is important to know as well is measles is a very serious disease. However, it is manageable. And it's manageable by being vaccinated. And that is one message that we definitely want to take home to all of our residents, that what they can do to prevent and promote what we're trying to accomplish here today is to get vaccinated to protect the community, themselves, as well as all the other families in the community. So what we are doing. So our initial investigation does consist of identifying with this child exactly who this individual was in contact with. So as we start unfolding what's actually happening with that, we are going to learn about where this individual has traveled to, and I do imagine that this investigation will grow as more information is unfolded. Now again, with measles, it is a very serious disease, serious respiratory disease. And in Florida, this is the first locally acquired case that we have had in several years. So again, I do thank you for attending. Now, as far as the investigation piece, as far as what we have been doing.
So our team, as soon as we received notification, started initiating our investigation. And what that entails is interviewing to try to identify contacts that might have been exposed to the case and determine susceptibility to the disease. We are in the initial phase of that right now. So that's all I have for that.
From a school perspective, we certainly want to make certain that our students and our staff are safe and secure in their learning environment. We have been in constant communication with the principal as well as the Fairlawn family since this 6-year-old is enrolled at Fairlawn Elementary Magnet School. We are generating awareness, just as Ms. Hall indicated as she opened today's session. We want to communicate factual information to alleviate any concerns that families may have. We certainly want to encourage families to vaccinate their children as a prevention, as the health department has promoted vaccination, and this is an unvaccinated case of measles. So we are working through that, working very closely with Mr. Sperber and the health department to convey the medical information and keep our families abreast of the developments at that site as well as community-wide.
Is there any cleanup going on at the school right now?
This is an airborne disease, and so we are very cognizant of what is occurring at school, making certain that our maintenance staff is aware of quickly cleaning things up, but at this point, perhaps our specialists with the health department could address that.
So the way measles is spread is it is an airborne virus. It's spread through the air when someone coughs, but it's also spread through droplets as well when the person is symptomatic. And those droplets and virus can survive in the air and on surfaces for up to 2 hours.
So they are cleaning in area where the 6-year-old may have been?
The child has not been in school since April 10th, and so those hours have passed quite a while ago, and so there really is no cleanup to be done for that specific child in reference to that child, but we certainly wanted our maintenance staff to be aware of the fact that we need to stay on top of our cleaning as we do each and every day and ensure that we have a clean, safe environment for learning.
Can you walk us through the actions that y'all took when you found out about this student, just reverse 911 call?
From the school perspective? Yes, sir. I received the call directly from Mr. Sperber, and at that time he indicated that there was going to be a conference call within the next 30 minutes or so to provide additional information. He told me that we did have a student. He identified her age and was going to confirm the school site. So we then stayed in contact throughout the evening up until about midnight last night as he obtained additional information from a variety of health sources, and I then communicated the information to the principal as well as others throughout the district that needed to know, including our school board members and other staff members throughout the district. One of the things that we did to alert parents was to generate a message that went out through our school messenger system, and that began at 6 a.m. this morning, informing the families at Fairlawn, the staff at Fairlawn, that we did have a confirmed case. We alerted them to the press release that had been generated by the health department last night. We posted that on the school's website and made certain that families were aware that the information was present there. The principal also called a faculty meeting this morning at 7:30 in the morning, and we were present with our partners. It was wonderful to be united and to respond to questions after presenting an overview as Mr. Sperber did here today. So we alleviated some fears of the faculty and staff. We had a separate conversation, a more in-depth conversation with the grade level and the teachers who serve the child that has been diagnosed. Additionally, it just happened that there was a school advisory council meeting and a PTO meeting scheduled at that site early this morning. It worked in our favor because we were then able to inform parents on a face-to-face basis, and once again, support staff from the health department was available to respond to questions from our families as well.
Do we know how the 6-year-old is doing?
I do not. Do we have any information? I know she is not in school at this time.
Her last day was on April 10th.
April 10th, yes, ma'am.
That's correct.
I do have a question about how you said you're trying to decide where this came from. You said it's locally acquired, but you said you wanted to look at the travel. So is it someone else in the family traveled?
So again, we are in the initial phase of the investigation. So part of the travel history will come out. So we really have not identified exactly where the travel has occurred. We do know bits and pieces, and we're still trying to put it all together to build this puzzle, because it is a puzzle as far as trying to learn where the source of the infection came from. So again, it still is very early to determine where this individual caught measles, where she was exposed.
And like you said, correct me if I'm wrong, but this is the first documented local case in years.
Locally acquired case in the state of Florida. Now, there has been other cases in Florida, and let me see exactly when that was. So there has been a confirmed case in an unvaccinated Florida resident, but the difference is a locally acquired one, so it has been a couple years. So similarly to what Superintendent Yost mentioned about the process for notifying all the schools and not all the schools, but all the parents and the faculty, we have a very similar process of notifying the medical community. So a lot of the same information that was shared with the schools was shared with all the healthcare providers in the community, including the hospitals.
Superintendent, as I understand, y'all are actually on the phone today calling parents with kids who haven't been vaccinated, telling them to stay home. Can you speak to
Actually,
that?
we were working with our health department for that, and we understand at this time that all families have been contacted at Fairlawn of the children that are unvaccinated at this time. And there are 5 of them at this time.
How long will that be for?
I'll defer to our health department to respond to that.
So the incubation period for measles can range from 7 days up to 21 days from the last exposure. So theoretically, we would ask for anybody who's been exposed and is susceptible of getting the illness to remain out of school for 21 days.
Could you touch on how important you view vaccinations to be?
Vaccination is the key for prevention of measles, and
Would
it
be
is a
your-
good prevention measure as well.
What would be your message to parents who maybe are skeptical of vaccinations?
I would say to consult with their primary doctor or their pediatrician to get some additional information on it, and vaccinate their children if they have not been vaccinated or they need to be updated on their vaccines.
I stand here today as a kid who had measles, mumps, chickenpox, and it was not considered a big deal at the time. Can you explain to me why it is a big deal?
So measles is a severe illness. It can cause complications as well. Such as pneumonia and encephalitis, hospitalization. It can lead to multiple complications. And the reason it's a concern is because we haven't seen it in the last decade until these last couple years, how it's been popping up. So we would like to stop that transmission and prevent it from spreading further.
Is it something like, chickenpox and mumps, when you get it as a kid, it's not a big deal, but you get it as an adult, you have more risks? Does that occur with measles as well?
Anybody who's at risk for severe complications include children under the age of 1, pregnant women, immunocompromised individuals, as well as adults over the age of 20.
What do you say to parents whose kids attend that school? What should they be concerned about, if anything?
Great question, because that's what we're hearing from parents who are calling our school and our district office. Are my children safe in your schools? And the answer is yes, if they are vaccinated. Students who are not vaccinated, which we have reached out to every family, and they are cooperating with the health department and with the schools at this time, are the ones with the greatest risk. And so students who are immunized, who have been vaccinated, are perfectly safe in coming to school at this time.
Superintendent, we were talking to parents today. One outside the school was telling us it's bothersome that their children are around other kids that are vaccinated. What are your thoughts on that?
Understood. There is a statute by which we must comply, and that is statute 1003.22 that provides exemptions for families. And if parents are interested in exempting their children, there is a process that they must comply with. For example, if it's a religious exemption, they then work with the health department to process the appropriate paperwork, and that information is on file at our schools. Again, though, the preventative measure is vaccination, and we encourage families to vaccinate their children.
Out of the 5 that you said are not vaccinated, how long have you told them to stay out of the school and stay home?
The health department had the conversation with
So
them.
as Kim mentioned a little bit earlier, is what we're looking at is the exposure time when the child was last at school, which was on April 10th. So we're looking at up to 21 days after that April 10th, which would lead us to about the May 4th or 5th timeline. So that's what we are looking at today.
Vaccines aren't always 100% efficient. If my children were vaccinated, should I still keep an eye on them if they were exposed?
The MMR vaccine, which is the vaccine to prevent measles, is about 95 to 98% effective, and it's pretty rare to have any illness or disease if someone's got both vaccines on board, the 2 doses on board.
Now, we hear, go back to my history lessons in high school, that when the settlers came over, the Indians were decimated by measles because they hadn't been exposed before. I'm wondering, as we raise a generation of children that really haven't been exposed, do they get a certain help from me? Will my children, or is it going to become, harder on the younger generation than it was in somebody in my generation? Are we going to lose our, as a herd immunity? Are we going to lose our, what we have to fight this disease?
Maybe
I
you should
think-
explain what herd immunity is, because that's not a common terminology, so maybe we could
Sure.
start with that and work.
Sure. So with herd immunity, the idea behind that is to vaccinate a certain percentage of the population in order to prevent the spread of disease. So if you've got a certain amount of people who are protected, then those who are either not able to get the vaccine due to medical reasons, you would hopefully be able to protect those who are vulnerable. I think how to address your question is back to our key prevention message is to vaccinate so that we don't get to that point.
Good question for Clint. I know some folks would say this conversation really shouldn't be happening. Measles should be eradicated, and the solution is right here, vaccination. What would be your thoughts on that?
I think that's an excellent response to your own question. Is prevention is a key by getting vaccinated, and that is our take-home message that we want everyone who is watching and will listen and will read in the paper, that get vaccinated and prevent measles from occurring.
What do you think is going through the mind of a parent that's skeptical of vaccinating their kids? And how can that mindset be changed?
I'm curious what the fear might be for not getting vaccinated. So maybe by taking a look at whatever fears there are, I think that could be looked at. But from a science standpoint, there's no scientific evidence that the vaccination does cause A, B, or C. What we do know it does cause and generate is immunity to different diseases and viruses. So again, I would encourage them to read up on the Centers of Disease Control website, to look at the World Health Organization and other official medical sites to learn more about the vaccine and what it does and does not do.
We've had some parents ask us, at that age, they could fall and scratch themselves and they see a rash. They don't want to end up going into a panic. So what are some basics they can look for? Is it a rash that's going to be on the face, arms, or just face, arms, and legs, or what's the answer?
Good question. So the way the symptoms usually start is actually upper respiratory infection type symptoms, meaning cough, runny nose, conjunctivitis or watering of the eyes, and fever. Sometimes the fever can be as high as 105 degrees Fahrenheit. After that, for a period about 4 days of those symptoms occurring, then the rash will set in. The rash typically starts up around the head, scalp, and face. It presents as a macular or blotchy red rash, and then it will descend down towards the torso, legs, and out through the extremities.
And also, I want to call your attention to, in your package, you guys have these nice graphics. It gives a good quickie overview for the general public about what they should be looking for and what to do.
Are there people who should not be immunized?
Yes, there are some people who might have medical reasons why they should not get immunization.
What would they do?
If they've got any type of immunocompromised condition of that nature, they would need to follow up with their doctor, pediatrician, or provider.
Now, we're talking an awful lot about children here, but if I look back and I'm an adult who hasn't been immunized, should I go be immunized as well?
Yes.
Yes.
Do we have any other questions, folks?
Perhaps in closing, we could share the hotline,
Yes.
because that is something that we are sharing with our families as well. The number is area code 772-460-4357. Again, 772-460-4357.